Good day. We are Group 3 from DMD 1YO-5. This is our community project proposal entitled Project LIGTAS, a comprehensive disaster health training for Barangay Central Signal, developed in partial fulfillment of our Civic Welfare Training Service course.
The project is a collaborative effort among our group members, each assigned to key responsibilities. With proper coordination, we ensured that each component of this project was organized and purposeful.
Allow me first to introduce to you our team. I, Miranda Baggay, the group leader, our secretary, Julianne, and the following members: Jaycee, Nicole, Castro, Dannalee, Audris, Gozon, Marc, Maglonzo, Helena, Miranda, Erich, Palanca, Aliya, Cristina, Pangilinan, Sioson, and Kirei, Villete.
For our target barangay, we chose Barangay Central Signal in Taguig City. It is a densely populated, highly urbanized area. It spans about 77 hectares, 60% of which is hilly while 40% is flat, and it lies near Laguna de Bay and the West Valley Fault. These geographic characteristics make the barangay highly vulnerable to natural disasters such as floods, earthquakes, and landslides. Despite existing disaster risk management structures, there remains a lack of community-level participation in preparedness programs, a gap that our project
For
seeks
our
to fill.
project title and theme, we named our initiative Project LIGTAS, which stands for Life-Saving, Intervention, and General Training for Alert and Safe Communities. It reflects our goal of delivering hands-on training to strengthen local capacity in disaster health response.
The Philippines' location in the Pacific Ring of Fire and Typhoon Belt exposes communities like Barangay Central Signal to recurring disasters. The area has experienced actual incidents such as flooding from Tropical Storm Karina and a minor landslide in the Damayan area in 2022. Additionally, it has a potential magnitude 7.2 earthquake modeled by FIWOX. These facts highlight the urgency of proactive community-based preparedness. Our project addresses this by equipping local youth and leaders with basic life-saving knowledge.
Our objectives are fourfold. First, equip youth and leaders with first aid and basic life support skills. Second, conduct evacuation drills and emergency simulations. Third, identify local hazards and early warning signs. And lastly, promote youth-led sustainable disaster response. All of these are tailored to the unique needs and risks present in Barangay Central Signal.
Our direct beneficiaries are selected youth and active purok leaders of the barangay. They are physically capable and likely to respond first in times of emergency. Indirectly, the entire community, including the neighboring barangays, will benefit from the knowledge and skills these individuals gain.
From June 27 to July 19, we followed a systematic workflow. We began by planning the project carefully, setting the direction and assigning tasks. Soon after, we selected a barangay and conducted a needs assessment to guide our focus. With all the information gathered, we moved on to writing, revising, and finalizing our content, followed by scripting, filming, and editing the video presentation. The entire preparation process came together as we completed and prepared our final output for presentation. For our implementation plan, the first day of the project includes planning and meeting for smooth preparation, followed by the coordination with the officials that will make this program possible. Before the event, we will coordinate with barangay officials, and we will also accommodate the preparation of training kits and materials. Afterwards, to ensure the seamless program execution, rehearsal of the program flow is a must. As the program comes to an end, we will collect feedbacks to make some room for improvements, and we will then submit our final report.
The project is designed as a one-day event at Plaza Once Covered Court from 8 a.m. to 5 p.m. Comprehensive disaster health training for Barangay Central Signal Village's goal is to equip the community members with essential emergency response skills. The morning session of the program will be focused on overview and objectives of the program and group sharing, while the afternoon session will be on first aid training, basic life support, rescue and evacuation techniques, and emergency responses. Materials needed will include sound systems, tables and chairs, medical kits for simulation purposes, printed materials, and lunch and snacks for the attendees. To make sure the program runs smoothly, we've assigned specific roles and responsibilities to each member of the team.
Here is our program flow under program management. On the day of the training, we'll start with orientation and hazard mapping, followed by lectures and demonstration on CPR, first aid, and emergency response. In the afternoon, we'll simulate a disaster scenario and engage participants in a post-test and feedback session.
Our estimated projected budget is 5,000 pesos. Some resources like the sound system and venue will be provided by the barangay. The rest will go toward printed materials, demo kits, snacks, tokens, and certificates.
We anticipate challenges such as unpredictable weather, limited funding, and low turnout in afternoon sessions. However, we've prepared mitigation strategies and backup plans to ensure smooth delivery. So for our challenge, weather disturbances, lack of attendance, and funding. Solution: monitor weather forecast, backup indoor venue, and flexible schedule. Next one is promote the event in advance, early coordination, engaging activities. The last one is seek sponsorships, low-cost plan, borrowed barangay materials.
To sum everything up, Project LIGTAS is more than a one-time event. It's a sustainable initiative to develop local readiness and health resilience in the face of disaster. We hope this project empowers Barangay Central Signal to respond quickly and safely in times of need. That's it for the presentation of our project proposal. Always remember, ligtas ang may alam.